Welcome to Hamilton Fraser. I'm Sammy and this is our series of help videos. Today we're going to be talking about consenting and consultations, and we have Emma Brackey, our claims specialist, and Owen Woods, our marketing director. So, why is consenting and consultations so important?
Thanks, Sammy. What I would say is that practitioners have so much to juggle day to day, whether that's just managing the clinic, customer service, putting business plans together, general marketing. I feel the most important element that a practitioner has is the actual consultation process. Would you agree with that, Emma?
Yes, 100%. At the end of the day, the consultation is the most important part of the treatment. You need to make sure that everything is consented to. You need to make sure that the patient is aware of all the risks before they can obviously make an informed decision whether they want to go ahead with the actual treatment.
Yeah, I think when you say understand all the risks, it's explaining those risks and also making sure that they fully understand all those risks. Are they fully aware of the side effects? Have you explained all of the side effects? And if there was something that was very little chance of them getting, maybe it was bruising, would they actually be happy with that side effect, or would they come back and say, but you didn't tell me about this?
So do you have to tell them about every side effect or just certain ones?
So really what the patient needs to be aware of is what could happen with this treatment. So for instance, if they were having an injectable treatment, they will need to know that there is a good chance that you will get bruising. If you are piercing someone's skin with a needle, there is a very good chance that bruising will appear. You're also going to have a bit of redness there. You could get lumps from the filler. They need to be aware of all of this before they can decide if they want to have the treatment.
Absolutely. And it's having that dialogue with the patient. What is the reason why they are taking this treatment out? Is it because they've got an event coming up in the next week or so? If that is the case, and the bruising is going to be, will appear over that period, it might defeat the purpose of actually taking that treatment out.
Yeah, it's very important that they're made aware of the aftercare as well. For instance, if you were having a laser treatment and you know that patient is doing a 6 weeks tour of Australia, where obviously there is a lot of sunshine, then we wouldn't recommend that you went ahead with that, because obviously following laser you're not supposed to be exposed to sunlight. So you need to actually find out what they're planning to do after. As Owen said, if it is for a special occasion, you need to make sure that it does give enough time for any side effects to subside. So
what would happen if you didn't obtain consent?
Well, I think we all know that litigation in both the NHS and the private practice continues to increase. So if you don't obtain consent, how do you know and how can you provide evidence that you've actually discussed some of the risks with a patient?
Okay, and what would happen if you're trialling a new product or treatment? Do you have to tell the patient that?
Absolutely, yes, and it's not only just for that. Does a patient fully understand what product you are using? If they are asking for a particular brand of botulinum toxin, do they understand what brand you actually use if they ask for a particular product itself?
So what's the best way to gain informed consent?
It will definitely be having a one-on-one consultation. That way you can actually make sure that the patient does understand exactly what you're saying. You can obviously also engage if the treatment is actually right for them. If they're not sure on anything, you need to make sure that they are fully aware of the issues, the risks, and if it is a treatment where there is a lot of risks, best thing to do is go through them one by one, and you can even have a separate signature or tick box to make sure that you've gone through that. They just need to be aware of everything that you've said, and you need to make sure they've understood it.
I think you'll definitely agree with this one, that the consultation isn't a one-off. Every time you see that patient, you should go through the exact same process. Even if it's a patient that you've known for 5 years and they've continuously come back to you for different treatments, you should always seek consent.
Definitely. You never know what could have happened in their circumstances. They could be taking a different medication. Every time, even if you know the patient very, very well, you need to do a consent for every different type of treatment. You need to ask about their medical history if there's been any changes, because there could be, and if you don't consent and a claim is brought against you, you've got no proof that you've actually done a full consultation.
Can I ask you a question, Emma? How long should a practitioner leave between the consultation period and actually performing the treatment? Is there a recommended period?
It really is what the practitioner is comfortable with. What we would say is once you've gone through all the consultation, all the risks, best thing to do is actually give them leaflets with the information in. So not only have they heard it from you, they've also got something in writing. Again, the best way of documenting that you've actually done that is to send them via email. So you've actually got proof that you have sent them to them, because obviously if a claim was brought against you, they could turn around and say, well, I wasn't given a leaflet. If you've actually got a copy of a letter or an email confirming that they have been sent out to the patient, then obviously that is a great defence.
Is there any legislation or guidelines or anything out there so that people know what they need to tell their patient?
So what we would recommend is, we always say to go to the manufacturer's website and follow their guidelines.
So what are your thoughts on remote consultations?
I think a patient should always have a consultation face to face, and especially that consultation should be with the person actually performing that treatment. A patient should feel very comfortable that they've understood what treatment they're undertaking, and not feel pressurised in that. And so a face-to-face consultation, should bring out all those risks.
So an initial consultation should be done face-to-face, but if you adopt the two-step consultation process, could you perhaps have the second consultation via the internet?
Yeah, I mean, you could actually do that as long as you've had your face-to-face consultation. The most important thing is giving the patient enough time to think that the treatment is right for them. So say, for instance, you had a face-to-face consultation, a week later you could give them a call. If they still hadn't made up their mind, then you can obviously give them longer, but you can still, if they have any questions, you can answer their questions over the phone, as long as it is documented. That is the main thing. If you have any discussions over the phone or over the internet, always best practice to follow up with an email, so referring to our conversation. So again, there is written proof that these aspects have been discussed.
And when you are actually doing that documentation, things like managing the patient's expectations should also be included. Everything
you discuss should be in the patient file. Basically, if it's not written down, it never happened. It is your main defence if a claim is brought against you. If there's anything that you've discussed with them but you haven't put it in your consultation notes, there's no proof that you actually discussed it, so everything should be in there.
So I think we should talk a bit about photographs, because obviously you take photos. Would you trust the patient to take their own photos after, or what's best practice with that?
We think that the practitioner should take their own photos. With injectable treatments, they have to take photos immediately prior, so not at the consultation. Take them just before you're going to have the treatment done, and then again straight after. We would recommend you have a full face and not just the area that was being treated, so you can actually see that if there is any issues, that you have got a full face photo, so you do know it belongs to that patient. We would also recommend that photos are taken even if you're giving Botox. The effects don't start straight away, but we would recommend taking photos just to show that there wasn't any issues.
Absolutely, and that's it's not even an issue. Sometimes it's dissatisfaction.
Yes.
So you can sit with your patient, show them the before and after photos, and actually show where the treatments actually have enhanced.
Yes, with dermal
features.
fillers, because they are instant. So you can show them the before and afters. A lot of the time, if a patient actually hasn't seen the before and after photos for a while, they look in the mirror every day, you get used to how your face looks, but then if you go back and compare them, you will notice a difference.
So if they've had the same treatment in the past with you, do they still need to consent to the treatment again?
Yes.
Yes, and if you're doing multiple treatments, at the same time, does each different treatment need a different consent form, or can I put them all on one?
We recommend separate consent forms. With the consent form, it goes very detailed into each type of treatment. It lists the risks, different aftercare for different types of treatments. We would recommend they're done separately and all of them signed and dated by the patient.
Okay. And what about if a practitioner's not charging for the treatment? So if they're treating their family or friends, do they still need to obtain consent for that?
100%. Any type of treatment needs a consent form to be signed.
It's interesting you say about the price there. I think also within the consultation process, price should actually be brought up, because a single treatment might not get the results that the patient's actually looking for. So it would be good to actually explain that there might be a series of treatments needed over a course of 6 months or whatever the period is, so they fully understand that this is a journey and not a one-off process.
So how do I know what to write on each consent form for different treatments?
So what we don't write the consent forms here. We would actually refer them to the manufacturer. Each product have different risks, so the majority of the manufacturers do actually have consent forms online, which you can actually use or take bits out as a template.
That's great, thanks Emma. And so what would you say the main things to take away were about consenting and consultations?
Note everything.
Note everything. All right, well, thanks Emma, thanks Owen, and we'll see you again soon.